Did you know that wheelchair skills and falls training can go a long way to preventing future fractures? Hi, my name is Anita Kaiser, and this is part 2 of episode 8 of the Bare Bones podcast, Snap and Crack, where we'll talk about rehab following a fracture and fracture prevention. Joining me again is my colleague Wendy Murphy, who has over 30 years of experience living with a spinal cord injury, as well as our guest from part 1, Dr. Kathy Craven, a senior scientist at the Kite Research Institute, medical director of the Spinal Cord Rehab Program at the University Health Network, and professor at the University of Toronto. Welcome back to the show, Dr. Craven.
Thanks for the invitation to be here today, Anita.
So in part 1, we talked about the most common ways to break a bone in your leg, who is most at risk for getting a fracture, and the specific leg bones people with spinal cord injury are most likely to break. And you also described some of the warning signs to look out for if a person suspects that they may have broken a leg bone and what steps that they can take. We ended off that episode by discussing some of the different ways to manage a leg fracture and the potential complications that could arise in the early and late stages of fracture healing. So in this episode, I want to switch gears a bit and talk a bit about rehab following a leg fracture and how we can prevent future leg fractures. So I'll start off with my first question. Can you tell me a bit about at what point should I be approaching my rehab team if I had a fracture?
Almost right away after a fracture, it's really important to contact the members of your rehab team. In general, your rehab team can help you to facilitate fracture healing, to help you monitor and prevent the health complications of fracture, especially some of those late complications we discussed in episode 1. They can help you begin to restore your functional abilities and to help you think about what strategies are needed to prevent future fracture.
Now, who should I involve from my rehab team to help me get back my mobility?
That's a really great question, Wendy. And this is a question that's a little bit personalized for the individual. So I'm going to sort of talk about this in big categories, but let's think about this. If you are a wheelchair user, talking to a physiotherapist would be really important. They can help you to restore your baseline lower extremity range of motion. So how much movement you have in your hips, knees, and ankles to ensure that you can get back to the optimal seated posture in your wheelchair. It would be important as a wheelchair user to talk to an occupational therapist and have them do a seating assessment to make sure there has been no new change in your leg lengths or alignment of your lower extremities, as your sitting posture may have changed. And they want to make sure that you are reducing your risk of pressure sore when renting or using an elevated leg rest. So particularly if you have had conservative care for your fracture. And as your fracture heals and you're becoming more active and returning to your usual activities, you may need some general reconditioning and a chance to upgrade your transfer skills. Many people may have to change their transfer technique or revisit some of their community wheelchair skills after a fracture. If you are a wheelchair user or somebody who walks with or without a gait aid, you should talk to your rehab doctor or physiatrist. They can help you in completing a fracture risk assessment. They may need to order a bone mineral density test and review with you the value of osteoporosis therapy. So changes in your diet to increase your calcium, the role of vitamin D, and you may need to explore the role of medications in reducing your future risk of fracture. I've talked a lot about what wheelchair users need. So that was talk to your physical and occupational therapist as well as your rehab doctor. If you're someone who walks with a gait aid or walks independently, it's very important to work with your physiotherapist to get your lower extremity range of motion back before you start participating in weight-bearing activities, such as standing or walking. When you are developing low bone mass, you have reductions in both the trabecular volume and number, as well as in the thickness of the cortex around the bone. So it is important that we restore range of motion and that we're loading bone anatomically. So you want to get back your hip, knee, and ankle range of motion before you start participating in weight-bearing activity. And for those patients who do walk, there are some people who may need a brace or orthotic to reduce their risk of pressure injury or to accommodate for a change in the alignment of your lower leg or differences in leg length between the side that was fractured versus one that was not fractured. Oftentimes after a fracture, your leg length is just a little bit shorter on the side where you had a fracture. And so sometimes people need a small change, like a little heel lift in their shoe or other things to keep their pelvis level when they're walking. And if you had a fall that was the cause of your fracture, many people need to do a bit of gait training with a therapist to build up their confidence again for walking and navigating obstacles. And of course, there is balance training that can help improve people's self-esteem for community mobility. So in general, you should be talking to your physical therapist, your occupational therapist, and your rehab doctor. But the conversation is a little bit different depending on whether you're a wheelchair user or a walker.
Yeah, and it's quite a few different things to consider, while you're trying to get back your mobility after a fracture. So once our fracture is finally healed, are we basically good to go at that point and just get on with our life?
Yes and no. So once you've had a fracture, your future risk of fracture is high. You don't need to come and use the healthcare system as much as you probably were during the time of fracture healing, but you do need to come back and see your rehab doctor once a year to monitor your bone health, to make sure that you are at least maintaining your bone mass and you're modifying any modifiable risk factors for fracture through diet or lifestyle intervention. So when people most want to be divorced from the healthcare system after getting their fracture to heal, it's still important for them to come back and see us and for us to monitor their bone health over time.
You've offered some great insights to our listeners, Dr. Craven. Tell me, what are some of the recommendations you'd make once the leg bone is healed to reduce the risk of future fractures?
Really great question, Wendy. When we think about preventing future fractures, I think about this a little bit differently for different groups. So in the first episode of this podcast, we looked at the whole osteoporosis paradigm that is featured in the Paralyzed Veterans of America Bone Health and Osteoporosis Management Guideline. Once you've had a fracture, it's important to go back and see, are there any modifiable risk factors for fracture that we could get rid of? As an example, if you're taking medications that have adverse effects on bone, could we switch out to another one? We want to make sure that if you have any lifestyle risk factors for fracture, that we try to modify them, such as, reducing people's nicotine, caffeine, and alcohol intake. And we want to make sure that people are getting optimal but not excessive dietary calcium intake and have a therapeutic range 25 hydroxy D serum level. And that there's been a really systematic approach of looking at fall prevention for that person in their home environment. So this may involve a home assessment to look at things that might help with fall prevention, such as the installation of grab bars, changes in lighting, or removal of carpets in someone's home, and revisiting the need for drug therapy to reduce the future risk of fracture.
So thank you, Dr. Craven. There is a great saying by Thomas Adams where he says, prevention is so much better than healing because it saves the labor of being sick. So thank you for sharing with us some of those strategies to prevent future fractures. Now, as a final recap to end off this 2-part episode, what would be your take-home message?
Once you've had a fracture, get advice from your rehab team, physical therapist, occupational therapist, and rehab doctor on ways to prevent future fractures.
Thank you. So if you found today's talk interesting, check out our action planning tool on the website at www.sceifragments.ca, and feel free to send us your feedback using the survey provided on the website. In episode 9, we'll talk about directions for future research.